For those patients that are here for the very first time, you're part of the family. Welcome to us. I'm going to start with positivity because that's what the symposiums have been about. The morning is all about learning, listening, having great takeaways, and then we have our patient panel after lunch.
The program at UCLA brings together clinicians from different specialties who have a primary interest, expertise in pancreatic diseases.
It brings hope, and then it gives the opportunities for the doctors to get together and talk about some of the things that they're finding.
We're here to hear from and to see the patients who've experienced pancreatic cancer and who are doing so well recovering from it, and in many cases years and years and years past their recovery.
One of the most important things that I forgot to tell you this morning is that we don't bring statistics into this room.
I'm sorry, you are right, it is pancreatic cancer. You know the statistics, you've been through it before, you know no one survives, so go home, put your house in order. But in the meantime, let's start treatment so we can at least give you the best quality of life for the short life you're going to have. Every once in a while I meet him in the hallway, and it's very, very justifying on my account to be able to say hello to him and give him a hug and say, remember, I wasn't going to survive 6 months, I'm going on 15 years on April 1st.
I was diagnosed in July of 2015 and got my all clear in May of last year. I was on a bad news and negative news ban. I didn't watch local news on television. I put a big request out to anybody I knew anybody that had a good experience with pancreatic cancer and was a survivor to please call me.
It's very hard for me to ask for help, but what I really, really learned, and still learning today, you have to let others help you, especially your caregivers.
Attitude is really the most important thing. Even before I was diagnosed with this, I had learned in some way that in life you can choose to be happy or sad.
I just want to thank Aggie and the whole UCLA medical team for allowing me to be here, where if I would have stayed at the small community hospital, for sure I would not have been here.
And I remember after hearing the words from the doctor, I went into the car, I turned on the radio, Bob Marley sang to me, every little thing's going to be all right, and it was.